Hello, everyone. My name is Kelly Quinn, and I'm a certified recovery peer advocate and a recovery coach professional. And I'm very excited to introduce you to a group of peer professionals today that are going to share with you the impact that peer services has made on the treatment field.
Hello, I'm Reed Wodrick, and I'm a certified recovery peer advocate and a certified eating disorder recovery coach. I've been both of those for about 2 to 3 years now. Peer services has proven to be quite valuable here at Strong Recovery because of its person-centered care. Our peer specialists assist clients with engaging the community, taking them to recovery fitness here in Rochester, the Creative Wellness Center, AA, NA, HA, Refuge Recovery. We make it our main goal to do what the client wants, not what we think they want. Again, I just want to emphasize that we are person-centered. Here at Strong Recovery, I have brought together a movement group that incorporates recovery fitness in Rochester and art journaling that is called Create Recovery Group. During this group, we do different topics and show people that it is a good skill to have if someone is having cravings or thoughts or just needing to take some time away from their day. And the Peer Lounge has given a great opportunity for clients to meet other clients in recovery and to meet the peer specialists here at Strong Recovery. I use my eating disorder recovery coach training with my clients here at Strong Recovery to provide a body neutrality concept by challenging food language, exploring the relationship with movement, discussing ideal self versus true self, and changing the cycle of disordered behaviors.
Hi, my name is Kelly Sharada. I am a recovery coach professional and a certified recovery peer advocate at Strong Memorial Hospital. The Summits unit seeks to address the divide between medical care and substance use disorder treatment. As the peer specialist, we aim to help our patients heal both physically and emotionally from their addictions. I am able to be the bridge between a population that is often disenfranchised with the medical system to a team of physicians and nurses who are committed to providing non-judgmental care and support. This is a photo of myself at Paisley Park in front of Prince's last portrait before his untimely death after an accidental overdose. I came with my father, who has been my unfailing cheerleader since the day I came home. We visited the park on what would have been my 2-year anniversary of being clean had I not stumbled a few times. It was all the more powerful to know that I was not alone, as I met many guests that day with their own stories of addiction and recovery. Prince, my hero, was a powerful example that addiction does not discriminate between famous and unknown, rich and poor. So knowing this, I am mindful to be just as open-minded because everyone deserves to live free and recover. Our instrument donation closet allows patients to express their creativity and process their experiences through music. Our clothing closet ensures that patients are more agreeable to stay to complete their treatment when they are not uncomfortable or self-conscious. Our motivational poster installation is full of quotes that remind our patients to look inward, that encourage introspection and provide hope. The Summits Memorial and Meditation Garden and Stone Display aims to provide a quiet, calming place where patients can interact with nature, feel the sun on their skin, and reflect on where they've been and where they are going in their recovery journeys. The stones remind us of who we have lost and who we continue to persevere for. 7 years ago, I got high for the last time in the bathroom at my NA home group, full of shame and remorse. But today, I can look at myself in the mirror and know that through my work with Strong Recovery, I am a role model. Today, I am fulfilled and provide ethical, patient-centered, and deeply personal care to patients from all walks of life. I'm able to leverage my lived experience and use it to encourage people on their roads to redemption and betterment. We do recover together.
Hi, I'm Tanner Linton, and I'm a certified recovery peer advocate. I've been in the field now for close to 2 years. In my experience, peer specialists or peers bring a lot of value to the table because we have the life experience. We share the same bond and understanding as the people that we work with. We help guide and mentor them. And by just doing that and being ourselves, the patient, the person will always feel seen, heard, and understood without any fear of judgment. Connection is the biggest and most important tool for someone's recovery. And by connecting with a peer specialist or peer, that's the easiest way to connect. May 7th of 2019, I chose to work towards a better life, and I decided to get sober. In the beginning of my sobriety, I struggled a lot to connect and to understand where I fit in within the recovery community. Once I started actually working with a peer specialist myself, that's where everything changed. She made it very easy for me to make the decisions that I needed to make and understand that they are my decisions and my choices and my options. I was never being told what to do. So I made my recovery my own, and she helped guide me to that. Here at Strong Recovery, I've been given the opportunity to start 2 new groups. The first group is called Pride in Recovery, and that's where we discuss navigating our identity in recovery within the LGBTQ+ community. My second group that I started, it's called Recovery Playlist. This group provides a sense of connection and understanding to others as well as the individual at a deeper level. During the group, we listen to music that relates to recovery. Then we have an open discussion and to also talk about how it relates to their own recovery. The song choices correspond with the different phases within recovery.
Hi, my name is Abigail Walker. I'm a certified recovery peer advocate at Strong Recovery. As a peer at Strong Recovery, I'm given the freedom to share my personal experience with substance use and recovery. Our stories of triumph show how people living with substance use have struggled, coped, and triumphed. I can support others by sharing what worked for me in overcoming challenges, overcoming barriers, and what I do to maintain my recovery. As a peer at Strong Recovery, we get to do groups. I help facilitate the movement group. This group focuses on movement and how it can help improve your recovery. Sobriedad Fuerte, relapse prevention. This group is for the Spanish-speaking community. The Hispanic culture can be resistant to admitting substance use or a mental health diagnosis. As a Latina woman, I can share my experience with overcoming these fears and barriers and inspire hope for change. I also participate in the Patient Advisory Committee. This committee helps bridge the gap between Strong Recovery and the patient's needs. This allows the patients to have a direct influence in their program at Strong Recovery and makes the patient's voices heard.
I hope that in listening to these peer professionals, not only have you been able to learn about peer services and all of the amazing things that it has to offer, but I hope it also deepens the understanding that it is true when we say we do recover. Thank you, everyone.